I'm Kat McDavitt, and I am here today interviewing another Lady Boss Crush, Dr. Jaime Bland. She's the CEO of CyncHealth, the health data utility for the Midwest. I'm so excited that all of you all get to meet her. And I do want to kick off before I hand it over to Jaime to do her amazing introduction and tell a story so you all can just get a feel for who Jaime Bland is in my life. I met Jaime while at a bar, as one does, with a mutual friend, and you could just like smell the power dripping off of her. And I tried to approach very slowly because you have to do that when someone has a power bubble around themselves. And I remember introducing myself, "Hi, I'm Kat McDavitt." And she took like a swig of whiskey, looked over her shoulder and said, "Who are you?" And that began our great friendship. So here we are today, friends and partners. And Jaime, I'll let you take over now.
I think that's a little more dramatic. I don't remember. I'm like, I may have taken this sip of whiskey and then said, I probably should know.
Should I know you? which actually is a little bit better. Yeah.
So, yeah, well, Jaime Bland, President and CEO of the CyncHealth Enterprise, which Kat often tells me I have like 16 nonprofits, but we have 5.
Oh, it's only 5. It's only 5.
Keeps me pretty busy, but so a little bit about me. I am a nurse by background. I started my career actually as a CNA. I've held every job in healthcare. I've done patient transport. I've worked as a nurse tech. I've worked as an LPN, then an RN. Then I went and got my DNP, so Doctor in Nursing Practice in Public Health, which how I got here really. But I started my career as a staff nurse and really kind of was focusing on med surg, focusing on doing the traditional nursing stuff. And then 9/11 happened, and my husband was prior active duty Air Force. So he was ready to take a job over in the Middle East a few months after 9/11. So we packed up our family and moved to Doha, Qatar, and planned on being there for 2 years and ended up being there for almost 10 years, 6 of which I worked for the U.S. Army in Qatar and managed a clinic and learned a lot of things about emergency medical response and the military medicine and public health and working with in a country that is not yours and navigating all of those kind of intricacies around culture and just different experiences and bringing cultures together from Canada and Australia and New Zealand and Germany to try to really do something in a community. And from there, I learned a lot of things. Patience and resilience is one of how to get things done and collaborate, and really has fit in well with where I'm at today as far as health information exchanges. And
yeah, that's a little bit of a jump. That's a little bit of a jump, right? Working with all those different groups in a different country, and then you health information exchange. So how did that happen? How did that specifically happen? Because you jumped from clinical care into basically leadership and administration. So
yes. So when I was working, so I went from the Army to work for Qatar Foundation. And when I was with Qatar Foundation, we were working on the National Electronic Health Record. So I was part of all of that work. And we built the hospital, which is operational today in Doha, a women's and children's hospital called Sidra. And then part of that electronic health record experience and launching that. So some of the planning there, data warehousing. Then I came back and I went to work for the VA. So I was telling Kat this earlier, but I read a book called Best Care Anywhere, and the picture that it paints about the VA healthcare system and, really kind of pulled at my, patriotic heartstrings and the work that I did with the Army. And so I went to work for the VA, where I led patient-centered medical home, which is branded something differently within the VA, but I led that within the primary care service line in the region. So I got to get to know clinics and communities from North Dakota, South Dakota, Nebraska, Iowa, Minnesota, into Wisconsin. which we had 8 hospitals and 70 plus clinics, and we're rolling that out. And that was hard. It's hard work doing that kind of transformation. So leading physicians through change and leading nurses through change and population health management and using data and using claims information and performance information to really inform on how we were caring for veterans. And through that, I learned a lot about communication around data, using data, and where to get sources of information that you needed to really facilitate transformation. And that was including data from the external community, which is where I first encountered health information exchanges in early 2010s, when they were probably known as HIOs or RIOs, or were really kind of funded through these ONC interoperability grants, and then just starting out. So that was my first touch with an HIE when I was at the VA.
Right on. So what was harder? So you talked about you were in a different country for 10 years. You worked with the US Army in a different country, and then you worked for, I think you said, the Qatar Foundation. So was that experience less difficult than working with the VA and all of this change management?
Oh, HIE works definitely harder than all of that.
So you leveled it up a little. It wasn't enough, so then you went into the HIE world. Got it.
But I think the challenge with something like the VA and the bureaucracy and trying to move that to a different place, that's significantly harder than working through a process to build a hospital in a place that this is really a greenfield type of experience, right? We're going to build a women's and children's hospital. There wasn't one there. All of the programming and engagement that was needing to be happen. I mean, it was a big, beautiful building, a lot of engagement around it, a lot of community buy-in around that. So whereas navigating cultural differences and administrative differences between, American medicine versus Canadian versus, administration that was from Australia and nurses that were from Canada, all of that, I think, can be complex, but we generally spoke the same language. Trying to get movement in a bureaucracy like the VA, one, I think you have to be willing to push back on no. And then, is that really a no, or is it a no from that person? And do they have the authority to tell me no? And then navigating around that person if need be. So really trying to figure out who is the decision maker within this bureaucracy. And you just have to find the right person to say yes, right? So there was a lot of things that we did within our service line that were considered to be innovative. It was really navigating those politics. And I think I probably learned more about politics and engagement and navigating a space like HIEs when I worked for the Army and the VA, because you have to navigate those bureaucracies to be able to get stuff done, right? Otherwise, you take the first no and you never advance. And I'm not
I think
really good at that.
That is so interesting to hear you kind of articulate that, because I was thinking earlier, what we always ask, what is your superpower? And I was like, what is Jaime just gets stuff done, but like how and why? And I think that might actually be it. You are incredible at kind of identifying, seeing the playing field and navigating these very, very complex systems. I mean, we're talking about whole states at a time you're able to be successful with, and maybe that's it. You have that experience navigating very complex systems, and you're able to apply that over here.
Yeah, for sure. I think when I was overseas and navigating politics, I was very young and naive. But looking back, that was to my advantage, because I didn't know who was going to yell at me or who was going to tell me no, but I certainly asked the questions because I had to get this objective done. And I was so focused on, goal attainment and ensuring that thing got done, that I really didn't take it personally if somebody told me no. So I don't know if I would have the same success now, but I think now I've just built up a tolerance to no.
There is an advantage to being young and dumb, right? Like as I always say.
Absolutely. because I think that was one of, things, being young and not already kind of beat up by the system. I was able to say, well, that no really doesn't make sense. Why would that person say no? And I'm also kind of like a processor, like I really reflect and think about things. So I'm like, I wonder if I ask it this way, or if I go ask this other person who I know has at least hierarchical influence to this person, maybe I should approach it that way. So I learned a lot from that Army experience, and then taking that over to the VA and understanding, the difference between policy and rules and regs, and how to navigate people, policy, rules, and regulations. And I think that's really what has been a recipe for success in the HIE space, because the space is complex, because it is tied to all of those things. It's tied to state politics and federal politics and policy, rules, and regs within CMS, and under being able to unpack all of those things and build a business model around it.
Yeah, no, absolutely. You also, I think, in addition to just understanding the landscape and being able to navigate it, what I've seen out of you is you just seem to be very tenacious. And like you said, I think it was an exercise in patience and resilience when you were talking about your time in the Middle East. And you told me this incredible story a little bit ago about your first, I think it was your first week in the VA. And this is kind of a funny example when you need to tell a story about when your shoes froze to the sidewalk, but kind of how you just processed that problem and kept going forward. Will you please tell everyone, because it is one of my favorite stories that you've told today.
So one of my first trips when I started to work for the VA was to Wisconsin in the last week of January. I think it was January 27th, to be exact.
You remember the exact date?
This is like 8 years ago, and I still remember this. So one thing that I have not actually accustomed back to when I moved was like shoes and socks, right? I still wear flats. I really don't prepare for weather. So when I went to Wisconsin for this clinic visit and training, it was early in the morning. I was getting ready and I was going out to my car, and I had stuff in my hands. I had a coffee in one hand and my bag in the other. And I was walking out to my car, and it was negative 70. And I paused to like readjust. But when I went to move again, my shoes had stuck to the ground because my shoes were like warm. It was so cold, they stuck like if you stuck your tongue to a light pole, right? A metal pole, like in the movie.
This is Jamie's first experience after her time with the CyncHealth Foundation.
Yes, I was woefully underprepared for this freezing cold event. So I ended up having to get my shoes. I was afraid that if I lifted my feet up and tried to grab my shoe off, that my foot would freeze to the ground. So I used my coffee to pour around my shoe, and we're able to get my shoes freed from the icy, snowy, wet ground. But
it was clutches of Wisconsin.
And I thought, this is not the place where I'm supposed to be right now. I need to go back to somewhere warmer for sure. But it is one reason that I don't think I've ever been back to Wisconsin since then.
Well, I think it's a good report, and also like lesson learned for all the ladies out there. If your shoes freeze to the sidewalk in negative 70-degree weather, you do have a coffee cup, and you can free yourself. Right. You can move forward. All right. So we haven't talked about how you actually jumped into HIE land. We've talked about like why you're crushing it. How did you get there? How did this even happen?
So I was working. So after I'd worked for the VA, I left and I worked for a clinically integrated network, an ACO type super ACO organization in Nebraska. And one of the things we were trying to do was leverage the HIE to be for data acquisition. Like, how do we bring data into the ACO, and how do we really build out this infrastructure that we need to be successful in these measures. And so I started working with the HIE and through multiple iterations of consolidation that was happening in the market and different changes in healthcare systems, we ended up being absorbed through, or the company I was working for joined another organization. So at that time, the HIE executive for the NEHII was retiring. So they asked me to come in and do a consultancy and then eventually work for NEHII. And I took a role as a director of business development while the HIE executive was transitioning out, and then ended up being named as the CEO. So that's how I got here, because we were trying to use it as an acquisition strategy. And I would say that was 2016-ish. So about really two years into full on, HIE operations in the state. But it was really difficult at that time to, it was before USCDI and, really some of the ADT standards. And so I would say that what we were trying to do then, we're doing now.
So when I met you, Jaime, obviously, there's the bar story. That's great. And I didn't really know who you were. I just kind of smelled the power, right? And I was interested in that. But, we got reconnected because we were both kind of campaigning and crusading on this interoperability issue at the federal level. And it was super fun. And we kind of hooked up and did that. And it was kind of a good time. And I remember, at the time I was working with Collective Medical full time, working on their government affairs work. And most of my career has been in this sector, and I've had a lot of experience with HIEs. And I remember talking to you and thinking, this person is like, one of these things is not like the others, right? Like you definitely had a very unique approach to, what we now call the health data utility, health information exchange, the next coming. And you approached it, I thought, very much like a private sector business person. And I also think the way in general that you're leading CyncHealth today is much more, it is a very different leadership style. And I'm really interested in that. So, the question I have is, overall, how did you develop this style, right? Because you don't have that like tech company experience, right? You come from a very different world, but you've adopted, I think, a lot of those strategies and leadership characteristics. Do you think your military background had something to do with that, or what really crafted this for you?
Yeah, so I do think it's my early exposure when I was working in the Army or working with the Army in JOHA, and really that was about adaptability and change, right? If you think about when I was there, it was early 2002, and Iraq didn't turn out to be what we thought it was going to be. Afghanistan didn't turn out what we thought it was going to be, and I was really working in the Army when it really migrated towards this more team of teams concept, and you utilize resources from other agencies. So the installation that I was assigned to really focused on, there might be coalition forces. There might, I was working in an Army clinic that was staffed by Navy that had Air Force support as well. So not only was I working across agency, we were having a constant shift of folks that were new. Like every 90 days we had a new team, and every 90 days we had different leaders that would come in, or and that could even be a turnover even more quickly. So we got to be very before agile was agile, right? We got this cadence down where we were able to shift and pivot quickly towards what the need of the day was, or need of the month, or whatever the ebb and flow of surges, where we went from having to support 5,000 to 15,000 and what that looked like. And I went from being a nurse to managing an EMS service, and managing a pharmacy, and managing a lab, and having to understand all of that in a highly stressful environment. But I just learned to deal with it all, right? I think it was the resilience of youth, and I like change. I'm not opposed to change. And sometimes people here at our organization, CyncHealth, is like, why are we changing again? Because I'm like, it's new and exciting. Doesn't everyone like that? Apparently, no, not everybody likes that. So I do hear that from some of my team members. But to me, it's like continuous improvement, right? One thing I was able to learn quickly as a young leader was continuous improvement. If it didn't work 90 days ago, how can I get to what are we going to do at this iteration of change that will help that be better? So a lot of, checklists, a lot of standardization. So I love data standards. I like, why doesn't everybody just do the standard thing?
So it's so hot, right?
So, I think if we could just get towards some of that, but that's why I think, I really push the organization towards development, not because we're developing product, but because we continually have to be better in delivering a value proposition. Otherwise, why are we here?
Right.
It's, we all could be doing different things, but we all are attached to this mission. And one thing that our organization definitely is part of, and I am sure that I communicate as a leader, is around mission. We are here so that we have a longitudinal health record, that we are here to make sure that, our futures and our children have access to healthcare records, and it is not hard to get access to them. Because today it still is. It's still hard.
Right.
It's still, this tied up in bureaucracy, but how do we free some of that up? And we're all here to do that, because we know that, if we can, reduce duplication and reduce cost and improve quality. And, when we're all paying for healthcare, it's not only the healthcare component, it's an economic component as well. So we are contributing to our community in that way. And that resonates with a lot of people, because we've all had to pay that healthcare bill. We've all had to pay for, why did I have to pay for 2 tests? Or, why did my grandma have to, deal with this when, she was sick and didn't, why did she have to go walk across the street to get her records and hand them to the hospital that was literally 50 feet from the clinic? And, those kinds of things that really don't make common sense, but we understand it from a healthcare perspective. And I approach it as though I'm a clinician, right? And I think that's where, why I approach it differently, is I never looked at the health information exchange as technology. I looked at it as information that we all need, whether I'm a person seeking care or a clinician or a provider delivering care. We all need this information so that we can deliver the best care possible. And it is not a failure of technology. It is a failure of people and policy that have prevented that from being possible.
Right on, right on. I love the note about leading with mission, right? Getting people aligned, especially when you're in a field with rapid change. And I think that, CyncHealth is definitely in that change because you are kind of changing the model for health information exchange. But I want to go back. So you were talking about team of teams. And I know that, there's lots of different, there's tons of leadership books out there by amazing military leaders, and team of teams, I think, is really interesting. Can you talk about how you've applied that to CyncHealth and just maybe talk about some of the outcomes or results that you've had with that? I love that model.
Yeah. So our organizational structure is, we don't even present it hierarchical, because, and I had a town hall this morning where I talked about the iterations of change, and we're in a health information changes or health data utilities, whatever you want to label it, is really in a place where you have to pivot towards policy. So when a policy changes, or the state Medicaid agency needs a thing, or a pandemic happens, you need to pivot towards that opportunity. And if we're not pivoting towards opportunity, we're not growing. So when I talk about team structure and a team of teams, it's not just the technology team, it's not just the clinical team, it's not just the operations team, it's all of those components together. So product and design and technology that come together to deliver on whatever the opportunity is that we need to deliver on. And it might make sense that these 5 people are assigned to this opportunity today, but when it comes down and there's a opioid problem that we need to tackle, it's a different 5 people. So, but it may be 3 of the same people, but we need to change 2 people out. And that's an operational cadence I set from the beginning, because it doesn't make sense to organize teams in a very hierarchical way when you're not the best people to be on the team to deliver the thing. And we want to be able to deliver the things. So when people onboard to our organization, I specifically talk about this pace of change, because it's not for everybody. And we have to be able to use the best people and the best information and use the best technology so that we can deliver what needs to be delivered today, because technology advances all the time. And it might be today we are doing this thing for health information exchange, but then within 30 days of, spring of 2020, we were doing testing results and reports and all kinds of things that we weren't doing before.
Right.
That's what needed to happen. But because we laid that foundation, we were able to make that happen.
That's awesome. So I know we've talked a lot about how CyncHealth responded to the pandemic. And the results are pretty interesting. I know you presented on them a lot. You've had a lot of media attention around how you've been able to support Nebraska and Iowa, right? And I wanted to ask, and you kind of answered it for me, right? I wanted to ask, how were you able to pivot and do that? And a lot of other HIEs were able to fill that gap and really provide value to their communities as well. But you're saying you're kind of attributing all of that to kind of your cultural and leadership approach and organizational structure.
Yeah, I think
That's
so.
awesome.
I think it wasn't all vetted out, of course, when I reflect back on it, but it was definitely a foundation that was laid just in my experience and the ability to see, take this opportunity because it was built for HIE, right? The pandemic response, the data that was needed, and the gap between public health and healthcare delivery, we needed to fill that gap. So, pivot towards that, do the thing, reprioritize, and use the intelligence that's coming in fairly rapidly to reorganize teams and make that the priority focus. So I do think that was, from an incident command, mass casualty type of response, I definitely drew upon that, and then we're able to lay plans to be able to deliver what our state needed to do, right? We have a great relationship with public health. We have a great relationship with Medicaid, and we pay very close attention to what the need is, and we try to fill that, and not be a burden to public health or Medicaid or whatever the data need is. That's what we'll go out and get because that's what we were supposed to do. So we very much take that partnership approach. And bring in technology partners when it makes sense to do that, or consultants when we need to do that as well. So using that partnership effectively so that we can rapidly respond to what the community needs.
Right. Yeah, I think that's a great story of success and really how you can use organizational leadership and change management to do the cool things. You guys definitely have crushed it there. So those of you who know Jaime might know that she has this thing going on where she just straight faces everything. And I feel like I'm pretty good at reading people. Sometimes I have to ask her if she's actually, not sometimes, almost every time she straight face tells me some crazy story, I have to ask her if she's serious because sometimes she actually is. So when I think about Jaime, I'm always like, wow, I really think you've never had any problems. She just cruised through her career. She's a doctor, all these things. But I'm sure there are some parts of your career that actually were quite adversarial or really, really hard. So can you please humanize yourself a little bit so we all can feel like we someday can succeed as well, and tell us about the hard times?
I think my daughters are in healthcare, or they're in college, and one's a career in nursing and one's going towards a career in medicine. But I think they think primary care and public health is the only parts of medicine that matter, because they had to sit and listen to my presentations throughout my doctorate program because my husband was working in another state or back overseas. So as little children, they had to sit and listen. I'm like, okay, mommy's going to tell you a story.
Really? Really? You use them as your audience? That's kind of adorable.
And my audience. So, they think public health and primary care are the greatest parts of healthcare because of all of those things that they've heard, and because I would use them to, practice on, because I wasn't great at doing it in front of the mirror, and I had to improve my delivery and, be convincing when I was talking about, transformation in primary care. So,
is that where you developed the straight face? So is that where when you were practicing with your daughters? Just
I think I learned that in the Army, like never show like surprise or like how in the heck am I going to accomplish this? And, if you ever like show that doubt, like the colonel might take it away from you. So
Really?
know
Oh
anything.
man. I don't think I would succeed in that scenario. I feel like we must be, it's going to be interesting to watch this again and see my like over expressions of everything and your straight face.
Now, I will tell you that my older daughters now tell me that that's like the scariest thing when they tell me something and I don't react.
I believe
That
them.
they think it's scary, but we've all learned it. We've all been, different experiences. But I guess, if you think about the things that I had to do in that, those early 2000s and standing up a clinic and, surging and, oh, we're getting 5,000 new service members tomorrow, make sure the clinic's open 24 hours. And you're just like, okay, I'm going to do that. I don't know how I'm going to do that, but I'm going to figure it out. So, just kind of years of that, I don't think you can tell me anything that surprised me anymore about people or things I got to do.
It does sound like that's a unique experience.
Yeah.
Yeah.
So, a little bit of that, but.
So so we were talking about like the hard times, and you start talking about like, I'm like going to dig a little bit here, and you tell me if I'm off base, but I maybe cut you off and you didn't finish that story, but it sounds like obviously getting your PhD was like pretty free. Was it your PhD or was it?
It's a doctorate in nursing practice. Okay. So in public health and global health nursing, but I was working at the VA and I had 3 little kids and
a husband that was off
traveling back and forth to the Middle East. So yeah, it was tough. I don't remember a lot from that period of time because I wasn't sleeping a lot. But I want, that was one thing that I came back to the States to do, and I wanted to do that. And a lot of that was because of when I worked for the Army, I had this experience with the Naval Medical Research Unit in which we were doing some studies, and I really got a exposure to public health through military medicine. So it was one thing that was really important to me to be able to come home and complete that. And I thought I was going to do it in 4 years, and I did it in 5 years. But ultimately, there was a lot of sacrifice that went into that, so it was hard. My kids were small, but now that's why they work hard in school, because they, I think a lot of parenting is about modeling, and they saw me get up early. I was up at 4:30 and I'm studying, and they would wake up and see me, so they know what it takes to be able to be successful, right? And follow your goals. And I didn't have to do that. I probably still would have had a good job and been successful had I not done that doctorate, but it was important for me personally.
Yeah, I love that. I love that because I think I talk to a lot of people who have a similar problem, right? They have very demanding careers, but they have this other goal, whether it's education or whatever it might be, starting a side hustle or whatever. A lot of people just say, I can't do it. It's too much. And I think that I think a lot of people are more than willing to do, like you're saying, like just not sleep, right? Just get it done. But they have this kind of like overwhelming sense of family guilt, right? Yeah. And I certainly didn't. I'm not extremely educated, but I've received a lot of criticism in my career about, oh, you work too much and you're leaving your boys with your husband, and it's like, I don't know, it's kind of like his job, right? But yeah, I mean, I'd love if you could talk. I think that's actually very inspiring to hear you talk about it and talk about how, yeah, it really did suck and you didn't sleep and you don't remember it, but it sounds like it was worth it.
Yeah, I of course have all that mom guilt too, and I miss some things, or I don't remember them fully, but I think my daughters are really proud of me.
Yeah.
So
yeah, I think I love that. I think that what I've learned to tell people when they say, oh, like, for a while I was commuting, quite a bit to Salt Lake and around the country, and I missed a lot, and I get those FaceTimes from like, the Halloweeny roast and whatever. My husband and I wasn't there. And what I've decided is kind of like what you're saying, and I hope it ends up that way with me and my boys, but I think it's good for little boys to see their mama hustle. I think that's really good.
Well, it doesn't come easy, and I think that's what what my daughters see too is, when they're struggling, with their physics or chemistry, they remember that too, and it didn't come easy. So, they can at least draw upon that. And, they also see that I've had, pretty good success in my life. And, it's through hard work. It didn't just appear. So
Right. It
they
doesn't
also,
just appear.
yeah, it doesn't. And I think that's, and the reason that they chose nursing and they chose medicine was because they saw that too. So,
And I don't want to forget your third daughter. Now, your third daughter is a comic book artist. Is that what she is? Something incredible like
yes, she's not doing healthcare. She was not going to remember anything from that. So, she still, she, I think what she took away from that time is that, to be sure to speak up and say what you need. Bottom line up front. Otherwise, mom might not have time for that. But
yeah. Oh my goodness. I love that. I think that's really good for people to talk about in here, because it is a huge challenge to balance family and, all the guilt and all that. I'm sure I'll hear about it throughout my life. But okay, so we've talked about like your superpower, which like I think is just this incredible, like just top down system strategy that you can navigate. What is the thing that you're like the worst at?
Oh, like details. Like when I start talking details, I'm like I don't want to know the details of the project. I'm like, let's just do this big audacious project. But like some of the detail stuff, I'm definitely a big picture person, and I want to talk broadly about the project, but like the tedious details around like some coding errors or something, I'm like, I don't know about that. That does not make the project sound fun at all. But it's the work that has to be done. And I've done that part of the work too. So I get it that it has to be done and I respect it. I just, that's not where I draw my energy from. So I think that's kind of where I would say my team is like, she never wants to hear the details. They're absolutely right. I don't. But sometimes I do, but I think that's probably one of my weakest things is, getting some things.
So how do you get around it? Is it just surrounding yourself with people who know that and
like details? Yeah. One thing I will tell you that you walk around CyncHealth. These are people that I've probably worked with in other jobs. I've worked with through other community touch points, or I remember talent and I remember people that are special, and I try to bring them into this very special thing that we're building. Right. I think that's one thing that I'm, pretty good at. It's, surrounding myself by people that do things better than I do them. Right. And letting them be empowered by that.
So I love that too. I'd love to talk about that if you're willing. So that's actually not very common, right? Where everyone says, "Oh, I want to hire someone better than me," right? And if anyone's lucky enough to walk around your beautiful office in the strip mall, they'll see that the name tags on you have some extremely accomplished people in your building who are working with you, and I'd love to talk about just kind of, and maybe it's natural that you have that personality and you have that confidence that you're bringing in these people, but was there something that affected you in your career that made you like that, right? Where you're willing to have this group of superstars around you who are probably better at you than a lot of things?
That's a good question. I think it, just the various, situations that I was in, I was often not the expert in the room, right? But what I am good at is this systems thinking and looking ahead, to potential pitfalls or even, my lessons learned historically to, oh, that might not work. So maybe we need to bring somebody in that can offer that expertise. I think that because I was a leader at a young age, I had to ask people questions. I had to seek consult with, colleagues that were more experienced than I. And I guess that's like, I've never been afraid of asking questions or seeking consult. I guess I don't draw my power from hoarding all the information. I want to make sure that everybody has the information. But one thing I am good at recruiting people is around this mission, because especially the clinician people, right? They understand how difficult, and being a provider and wishing you had this information, like somebody can't remember where they last got care, or the medication that they're on, and you're trying to do the right thing and you just don't have the information, and that sucks. And or living a life of being a care coordinator, and you're trying to find somebody a resource at 3 o'clock on a Friday and everything is closed and there's no place to refer this person to. Like, I've lived that before. So I'm going to ensure that we build systems and processes around making that better. And that speaks to a lot of people that can see tangible things that we're delivering in the community that make that better, and people want to work on stuff like that. So
yeah, I agree with that. I think
recruit good talent because we're doing good things. So
yeah, absolutely. I think coming from Collective, we had a very similar approach, right? It was mission first, and we were little itty bitty, and people will tell you we punched above our weight class, right? Because we had this incredible mission and we had the big feelings, right? And we too hired a lot of clinicians, and I think that's key. I think there's so many healthcare technology companies out there that don't have clinicians on staff or even consult with them. I think that's a huge miss. For sure. One other strategic topic that I want to talk about. So you and I, we were theoretically, depending on your source, Collective Medical and CyncHealth were technically competitors, right? If you kind of dig down, and I think had an adversarial relationship for before our Great Bar adventure, right? And you and I have talked about co-opetition, right? And how you kind of turn into the slide, and you could make something really amazing happen. And at least in the Collective side, I know we would say that it's been a very, very good partnership. And we're trying very hard to show that we are good partners and we can do that. So talk to me about that strategy, because I feel like you've done that in other areas too, and it seems to always work out for you. And so I'd love to hear the thought on that.
Yeah, there's only so much room, right, in this space. And we're not building product, right? We are leveraging good products to do the things that we want to do and accomplish the goals that we want to accomplish. So when we met in the bar, I'm like, we're cut from some of the same cloth. So how do we
really my name's Kat McDavitt. You seem like you're really it didn't turn you off? Okay, that's good.
We can do good things together. That's one of my talents, right? Bringing good people together. So what I think about co-opetition is I would rather not fight. I would rather be synergistic, right? So if we're both trying to do the same thing and you might be a little bit better at it than I am, I'm surely going to try to work with you and come to terms that we can work together, because we can only go further if we do that, right?
Right.
But if we're fighting over the same space and we're trying to do the same thing, we should probably figure out how to work together. So that's really how I try to approach a lot of the spaces that we're in, whether it be the Health Information Exchange or SDOH or PDMP. We really got to figure out how we're doing the best thing for the people in the community. Right. And sometimes that may mean that we're working with technology partners that may previously been known as competitors.
Right. Yeah,
I think totally we can both go farther if we work together. So
yeah, 100%. So I know I've already had you for 50 minutes. My mom listened to my last Lady Boss interview, and she told me I laughed too much and that it was that I rambled too much. So like, clearly I'm not doing well on this round, but I'm looking forward to her criticism on this one. But okay, so tell me, we've talked about like, the hard things, we talked about superpowers, blah, blah, blah. So tell me about the thing you are most proud of in your career so far.
I think, generally every position, every job I've had, I've left it better than when I came. So I
Mm.
think that's one thing that I try to do. But I do think that when I leave this role, whenever that is, I have made an impact to truly shift the market in a different way. And that way is to really talk about it as a health data utility and not just an exchange, right? What we're doing is something different. And I think that's created ripple effects, and it's where the market needed to go. That's what the market needs to do. But until somebody did it, it was, an aspirational goal. So I think that's one thing that I'm very proud of is changing this space in a way that it works for clinicians and to reduce burden and to focus on delivering value and not just moving things from A to B.
Mhm.
So that's really one of the things I think I'll be forever most proud of, is that we truly shifted an entire market segment into a different place.
Yeah, that's absolutely true. I mean, it's again, it's system change. It's the Jaime special, right? Fundamentally changing the way an entire category has been viewed and what it does and the value it provides. That's awesome. Okay, so we only have a few more minutes left, but tell me, so if you could give advice to your younger self, right? You said you became a leader young, you kind of had a crazy start, but talk to me about what you would have told your younger self right now. What lesson would you give yourself if you could?
Oh, I think it's not always personal, right? Sometimes it's just business, and hire slow, fire fast.
Right. That is a lesson I have learned in my own career. Absolutely.
Yeah, I think in my younger years, I tried a lot harder to really make it work. Sometimes with people, and sometimes like now I tell people, if it doesn't feel right to you, I'm okay with you not working here, or just telling me you don't want to work here, or if the pace of change, like all these things have to be right for you. So it's not personal. I'm not going to take it personally. I think like in my younger self, I would have taken that as a personal leadership failure, when it's like, yeah, not really. Sometimes it's just personalities don't work and people just want to do something different. So that's one thing I spent way too much time ruminating on, like, why did this person quit? Oh, yeah, whatever. People
Right.
make decisions that they need to make. So, but yeah, that's one thing for sure. But I spent a lot less time worrying about that.
Yeah. No, I agree. I think that's actually a really good lesson. And I think that, yeah, especially if you identify people and you're the one letting them go, I think that's also, a thing for sure is if they're not in it and you can tell, I think that sometimes it's best to make those changes for your overall organization.
Yeah.
Sure. All right. So this is Jaime Bland. I'm so excited that everyone got to meet her and experience a little bit of her power bubble over the internet. You all, I don't know, where can they find you, Jaime? LinkedIn? I don't know. Where can you find Jaime? Yeah.
I'm on Twitter. That's about it. LinkedIn.
You are on Twitter. You tweet approximately one time a week. So we'll make sure that's maybe you'll retweet this. Maybe you'll retweet
I have 5
this.
nonprofits.
Yeah, that's true. You are a little busy.